Hi everybody, it's Dr. Angela Kenzslowe here, and today I'm going to do a short little video about anxiety disorders. So this video is going to get us set up for a series of videos about anxiety and the different types of anxiety that there is. But initially, what we need to discuss is the difference between anxiety and fear. So oftentimes we talk about anxiety and, we go with the social norm, and it kind of starts to get switched and reciprocal of anxiety, fear. Although they do interlap with one another, they aren't the same thing. So first, what's fear? Fear is our emotional response or our emotional reaction to what we perceive as an imminent threat. It can actually be an imminent threat, or it could be something that we perceive as an imminent threat. And when there is an imminent threat, again, whether real or perceived, immediately our sympathetic nervous system engages. That's our fight or flight. So immediately we are ready to either fight harder than we can normally fight, we're ready to run faster than we can normally run, or we're ready to freeze a little longer than we're normally able to freeze, right? So there's an immediate threat, or we perceive there's an immediate threat. We have this emotional response, which is fear, and our body prepares us to be able to get out of that dangerous situation. It's something that we don't even have to think about. It's just automatic, right? So sometimes I give this example of going to the zoo, and we're at the bear enclosure, right? And when we go to the zoo and we go to the bear enclosure, typically there's this big, thick glass wall between us. So we can see the bear can see us, and it's a great time. We're looking at the bear and we see the big claws and everything's wonderful and everything's fine. But what were to happen if that glass wall were to fall? We don't think about it. Immediately, our fight or flight is engaged, and we either run super fast, or if the bear comes towards us, we might fight, or we might just freeze and hope the bear doesn't see us. That's fear. It's imminent. It's right now. It's immediate. Anxiety, on the other hand, is our emotional response or our emotional reaction to something in the future, to a threat that we perceive in the future. Now, it can be a real threat in the future, or it can be something that we perceive as a threat in the future. That's anxiety. And it's a little different. So our fight or flight sometimes does engage, right? But typically it's stress, our muscles, we have this tension. We have these avoidance behaviors. We might avoid doing anything that will push us toward that future event, whether it's a task or talking to somebody or, doing something that we're supposed to do, right? So again, anxiety is our emotional response or emotional reaction to a perceived or real threat in the future, and fear is an emotional response or emotional reaction to an imminent threat, whether it's perceived or real, that is happening right this very moment. All right, so as we move forward with the additional videos, we now have a good baseline and understanding of fear. That is right now. That is not anxiety. It is something that is occurring right now, and I am afraid. That is my emotional response. And anxiety is, I really am kind of not too keen on taking this test that's coming up. I don't think I studied well enough, and I'm starting to get tense, and I'm avoiding talking to my friends because they're studying and I'm not. Or, it can be something even more, right? But that's for a different video. Today we're just talking about the difference between fear and anxiety, and I hope that you found this video helpful. If you have any questions, ask in the comments below, and I'll try to jump in there and answer anything. Keep in mind, though, however, that through the videos, this is not therapy. This is informational and educational only. So if you believe that you have an anxiety disorder, then please do what you need to do to be able to seek professional help with a psychologist or a therapist, counselor, or with your primary care doctor or a psychiatrist. All right? Thanks so much, and thank you for taking this quick time to watch this video.